People that have had either a lumpectomy or a mastectomy, you're invading into a huge muscle there. So we need to treat that also in a muscular aspect. So women after breast cancer, even 15 years later, may say, I'm no longer doing this or that I was able to do prior to surgery. So we're going to address issues such as posture, mobility, strength. Is there any adhesions to the scar? So we try to address all of that. But these women are having major surgery to their breast where they're either removing a lump or they're removing a breast tissue. They have to invade into the muscular tissue. There's been damage, there's been insult, and so we need to teach them how to regain their strength, their mobility, get back to the activities that they love to do. It doesn't have to be limited. We want to see women, whether it's been 2 months or 20 years after surgery, if they're still having problems, because we believe we can help them. One of the things that occasionally happens is lymphedema. And lymphedema is an abnormal accumulation of fluid in the affected limb. If it's breast cancer, that would be the arm. And so what we're doing in that treatment is, again, teaching them the signs and symptoms of lymphedema, because it's like anything. The quicker, the sooner it's diagnosed, the easier it is to treat. It is not curable, lymphedema, but it is not life-threatening. It is not something that has to change the way you live as long as we treat it properly. We treat it through a gentle massage, exercise, and then some type of compression wrapping. But not all women develop lymphedema if they've had breast cancer. It's a very small percentage of women that develop that. Our goal through the screenings is to catch this early to prevent it from getting worse. Generally, to get physical therapy, you need a doctor's referral. With the Breast Health, we have just started the program where we do screenings twice a month. So that you would call us and make an appointment. Then if we see that there may be a need for physical therapy, we would need to get a referral from the doctor. Sometimes with that one-time meeting, which is no cost, during the screening, and we spend 30 minutes with you, we can give you some instructions on what to do at home. But if there's further need, then we would need a prescription from your physician. So the Breast Health Center, we have an association with Dr. Ladazinski and with Dr. Clanahan. Dr. Clanahan has also started referring patients as soon as they have surgery at the hospital to have physical therapy or occupational therapy come in, give them a folder that indicates that we do these screenings, giving them some outlines on lymphedema prevention and on exercises to do at home. And the same thing with the Dr. Ladazinski. She has some postcards and is aware of our program. So we have worked directly with both Dr. Ladazinski and Dr. Clanahan on our program in coordination with the Breast Health Center. A young lady that had breast cancer and did develop a little bit of lymphedema in her left arm. She wasn't able to wear, she was young, 30s, couldn't wear the clothes that she wanted to wear. She wasn't able to even lift her arm up. Women are really scared after breast cancer. It takes an emotional and a physical toll on their bodies. And so through the treatments, we were able to allow her to return to wearing the normal clothes that she wore, because we were able to get rid of the swelling. She was having to continue with exercises, but these are the treatments that she needed to do in order to get back to wearing her clothes, picking up her children. Women are afraid to pick up their children, and therefore they don't do it, they get weaker. So she was able to get back to her normal life through the assistance in physical therapy of regaining her motion, her strength, and getting rid of the swelling.